The views and opinions expressed on this program are not those of Norfolk State University or WNSB-FM. Thank you for listening.
Is Hampton Roads Voices on Hot 91.
October is Breast Cancer Awareness Month. Breast cancer is the second most common kind of cancer in women, and about 1 in 8 women born today in the United States will get breast cancer at some point. National Breast Cancer Awareness Month is a chance to raise awareness about the importance of detecting breast cancer early. Hi, everybody. I'm Benita Adams, and today on Hampton Roads Voices, we're talking about breast cancer. And for National Breast Cancer Awareness Month, it spreads the word about mammograms and encourages communities, organizations, families, and individuals to get involved. What are the symptoms, the treatments, and options for women and men? Also, we'll hear from breast cancer survivors next on Hampton Roads Voices on Hot 91.
Is Hampton Roads Voices on Hot 91.
Hello, everyone. I'm Benita Adams, and welcome to Hampton Roads Voices, where we have timely topics, fascinating guests, and passionate callers here on Hot 91. Now, you may know that October is Breast Cancer Awareness Month, and breast cancer is the second most common kind of cancer in women. And Breast Cancer Awareness Month really is a chance to raise awareness about the importance of detecting breast cancer early. And so we knew it was very important to talk about this topic. So we have 3 guests today, 2 in studio, and 1 will join us just a little bit later. But first of all, we have Roshonda Poole from Virginia Oncology Associates. She is an oncology social worker and patient advocate. Roshonda, thank you for being here today.
Thank you for having me.
And then we have Clarice Johnson. She is a nurse navigator here in the studio with us. Ms. Johnson, thank you for being here.
Thank you, Benita.
And later on, we'll hear from a breast cancer survivor, Candy Bryant, will be joining us very soon. Now, ladies, again, Breast Cancer Awareness Month, and so it is so important, and we want to hear from you. Let's make sure that I give you the number. It is 757-823-9110. We want to hear from you. Give us a call, 757-823-9110. Are you a breast cancer survivor? And if so, what is your story? How did you find out you had breast cancer? How was it detected? Does it run in your family? And what does it mean to be a breast cancer survivor? How has your perspective even changed in life? Give us a call. That's 823-757-823-9110. So, ladies, let's get started with the basics, because even though it seems elementary, perhaps, I just want to start off with a definition, really, of breast cancer. What is breast cancer?
That's a great question, Benita. Breast cancer is truly just cells in the breast that begin to grow just out of control. Keep in mind, Susan Love, she wrote this great book, and she basically says that your breast is the only organ in your body that continues to change throughout your lifetime.
Wow.
Okay, so imagine when a young girl buds, through menstrual cycle, through having babies, through the change in life, that organ continues to change. And typically those cells grow, die off, grow, and die off. But in some cases, 1 in 8 women will experience those cells not dying off, continuing to grow.
Absolutely. And is there, which is interesting, and then I'm going to, Ms. Poole, I'm going to ask you as well, is there an age at which a person can get cancer, a breast cancer I'm talking about, of course? It can't be in children, obviously. It can only be in, adolescence through older age, or is there a particular age?
I would say there's not a specific age. If you have breasts, those cells can change.
Okay.
So I've never seen any literature that says 12 and up or 13 and up, and so no. Now, have I seen it? I've never seen anyone that young diagnosed with breast cancer.
Right.
So no, I can't say that.
But I'm glad that you just said if you have breasts, there's a possibility.
Right.
And I think that's very important for our listeners to know, because I don't want them to think, well, you have to be this age. It could only be here. It could only be there.
Oh, yeah.
That's why we're going to talk about a little bit later breast cancer in men, because I have really heard people say, oh, no, men can't get breast cancer. Come on.
Right. And that's false.
Men can. Absolutely false. Absolutely false.
Yeah.
And so when, Ms. Poole, when you meet a person that has been diagnosed with breast cancer, where do you start with them?
Well, first of all, I kind of look at the patient as far as the whole person, and I assess them as far as their family history, trying to determine their support or what they're going to have throughout the actual diagnosis or treatment. And I more so complete their history. I talk about different resources that I might identify could become barriers as they can continue to go through the journey. And that's how we start. And just establishing that rapport and that relationship to let them know that I'm on a part of their doctor's team and I'm the champion for them.
Oh, I love that, champion for them. So how important is family history? How important is that?
So it's very important, but keep in mind, people are like, how important? We have women, only 10% of breast cancer is genetics. Okay, so that's only 10%. So where's the other 90, right? So now you may have a rich family history of breast cancer, and you develop it, but it may not be genetics, all right? It could be familiarity. So genetics do play an important part, but again, that's only 10%.
That is interesting that you say that, because I would have assumed, actually, before I started with the research for the show, that genetics had almost everything to do with the person getting breast cancer. And I would imagine that there are many people out there who think the same thing.
For sure. Yeah. And so you always get people in that say, I'm the first person in my family. Why me? So we get that quite often. And then you do have those who are genetic. No, when they turn 18, yep, I have the BRCA gene, or, I have the Czech gene. So yeah,
okay,
only 10%.
So when we, actually, I think when you and I talked, and then we talked as well, you were saying that there are different types. And as I was reading, there are different types of breast cancer. Tell us some of them. I think, you didn't say there were 22.
So roughly, right?
Okay,
so
wow.
Keep in mind that breast cancer can develop in different parts of the breast. You have your duct, you have the mammary fold. There's different places in the breast that it can develop, and some of it is contained, right? So you can have what's called ductal carcinoma in situ, which is a stage 0 breast cancer where it's confined to the duct, or you can have invasive ductal, which is very common. A lot of women have the invasive ductal. So now we talked about different places where it can occur, but not only can it occur in different places, but the receptors are different. So most breast cancers are hormonal, but then you have those that are not hormonal. So you add on another layer to it, right? So now we don't know, we figured out where it is. Now we know what receptor it is. And not only that, you have different stages. So you have 0 to 4. So when you break that down, there are so many ways you can cut this pie. And so oftentimes women's like, well, how come she did that and I didn't get that? You have to kind of pull together the images, the path report, so you can get a really clear picture of what you're dealing with. But it's not a one size fit all. It's like, yeah, I'm a breast cancer survivor. Yes. But keep in mind, there's a laundry list of things that go into that.
I find that fascinating.
Yeah.
And I love that you said that you are a, did you say champion?
That's the champion, yes.
Okay.
For the patient.
So a lady or a man comes in and they've been diagnosed with breast cancer, no matter what kind it is, and we'll go back a little bit with that. Where do you start with them as a champion? Do you talk about diet, nutrition, working well with your doctor?
Okay. So a lot of times when I'm actually first meeting with the patient, it's more so first I kind of let them talk about where they're at with the cancer and understanding their actual diagnosis and what the actual need and actually the treatment of what's outlined by the doctor. So it comes to a point where you need to make sure that the patient is understanding at first. And once I am able to see if they understand, the next step is going to be able to see, do I need to identify any barriers or things that might become a problem or a concern or issue for them that can cause any type of stress or anxiety later on. So then I would address it from a standpoint of what type of resources is that patient's going to need and what type of support do they have to help them through this journey. So more so after I do all of that, we kind of create a plan together, and I kind of identify the goals of what we're going to do together at each visit, depending on what's going on, and we start from there. And a lot of times, patients not being informed or aware, I am more so their resource. I'm their go-to person, and I also am a part of their doctor's care team, so I can understand and communicate some of the things that they might not be able to say. Okay.
Something you said that really struck out to me, and that was said, and you said they have to understand their diagnosis. Do they also have to accept it as well?
Correct.
That must be it, I would imagine. That's a part of it. Okay, you say I have cancer. Do I really have cancer? It's almost that when people talk about the stages of grief and so forth.
Right,
Part
absolutely.
of that is the anger and the acceptance.
Right.
It seems that that's a part of this too.
Right.
Absolutely.
So
That's where Rashonda, as a navigator, I touch on it. It's like all these different entry points. So as a navigator, the RN, she touches on it just to make sure that understanding is clear. A lot of people say, speak English. And it's
Yes.
like, but I am speaking English,
No.
but make sure you make it understandable to them.
Right.
But just these positive reinforcements, like,
Right.
keep on educating them, because sometimes, as I said, there's a what they call health literacy, right? Some people just don't understand that language, if you will.
Oh, absolutely. And for a moment, they might be in shock. And that
That too.
speak English or what have you is, I hear your words, I see your mouth is
Right.
moving, but I didn't even absorb that somebody said I had cancer.
Absolutely.
Right. A lot of times at the first visit, they're overwhelmed with a lot of paperwork they got to complete, a lot of different documents about their treatment. So by the time they meet with me, it might be about the second or third time, they're like, I don't remember none of this that the doctor discussed. So that's why it's important to have that communication, that open dialogue with them, to kind of ask that question, what is their full understanding? And when they meet with me, one of my questions is do you understand why you are here today?
Absolutely.
Okay? So that's important.
That is so important. And so we're asking you, our listeners, what is your experience? Are you a breast cancer survivor? What was your resource system like? Did you have a support system? We want to talk to you about that. Our number is 757-823-9110. We're talking about breast cancer today on Hot 91.
Is Hampton Roads Voices on Hot 91.
Welcome back, everybody. I'm Benita Adams, and we're talking about breast cancer this month, being Breast Cancer Awareness Month. We're talking about breast cancer today. Don't forget to call in 757-823-9110. What is your experience? Are you a breast cancer survivor? Is breast cancer in your family? What's your story? And how do you take care of yourself differently if you are a breast cancer survivor? 757-823-9110. In studio, we have Rashonda Poole. She is an oncology social worker, patient advocate from Virginia Oncology Associates, and Claire Johnson, nurse navigator. So, ladies, right before the break, we were talking about, and Ms. Poole, you were talking about being a champion for the patients, and also Ms. Johnson, you were talking about how sometimes when a person hears their diagnosis that they have breast cancer, first of all, they have to internalize that. They have to believe it and realize that it's true, and that's one of the first things. But you also mentioned something that was interesting. I'd like you both to make a comment on this, are the support system. How important is having a support system as you're going through this process?
Well, Benita, I will speak on that first. It's just more important. It's very important because the patient feels alone. You often feel like you're the only one, you're isolated. I'm the only one with cancer. Nobody really understands. So having that support system is going to be really critical in that patient thriving and having a good quality of life. Because it's different things that can arise, where it was transportation with treatment, the side effects, the symptoms that they're going through. They're going to need that encouragement and that motivation to weather the storm that they're going through, both emotionally and also internally. So we've got to make sure that that support system is in place so that that patient can have that go-to person. And a lot of times the doctor team, the actual clinic they're at, and actually like Clarice said, like the navigator, we are their support system. They count on us. We're a part of that support system. So it's very important that we understand what's going on with the actual patient itself. Even that, so we all actually become family. We're their family. The nurses are their family that's giving them the IV treatment. The doctor is their family. So it's a lot of people that's a part of that support system. That's why it's very important to understand the patient and meet them where they're at.
Absolutely. And have you seen that connection, the importance of once they get the diagnosis and that support system, how that works hand in hand?
Absolutely. So I work in a breast center, right? And so when you come in for your mammogram and there's an abnormality and we need to biopsy, when we make that appointment for the biopsy, we make the appointment for the consultation, regardless if it's benign, not cancer or cancerous, right? When the patient comes back for that appointment to discuss their results, right, you can you can see the difference from that patient who comes in alone and that patient who comes with husband, sister, mom. Completely different dynamics. But you have to understand too, and Rashonda mentioned it, just developing that relationship with the patient. Some people are private people and they don't want that. And you have to respect that. But Rashonda mentioned it best. You understand that there's going to be an isolation like you've never felt before when you go through cancer treatment. And so it's really important that we try and tap into someone, whether that's a neighbor, whether that's a coworker, someone to just hold your hand, because there's going to be times where you need that additional support that maybe in life you never looked for before.
Why do they feel isolated, though? Simply because this is a very difficult illness, or is this across the board with any illness, or specifically breast cancer, this isolation?
Oh, we call it the big C.
Oh, yes. Okay.
Oh, nobody, when you say the word cancer, people just write you off.
Right. Immediately you think, I'm going to die.
For sure.
Right. Because that was a stigma, But look how far research has came and just treatment itself. So, but like Harry said, the big C was a word that was unspoken.
Wow.
Okay. And that's a lot of times it's just because the unknown, the fear of the unknown, or just not knowing about, as far as the education piece of that there is different treatments out there and different things, and understanding the stages. So that's a lot of reason why people feel isolated.
And even perhaps the isolation in maybe not wanting to reveal it, because people may see you differently.
Absolutely.
They may treat you differently. They may think in their mind, oh, they don't have much time left. So why would I do this or act this way or something like that?
Absolutely.
So it could be part of that as well.
Absolutely. And people they say, I hear it all the time, I don't want the pity from anybody.
Yes.
Right.
Or I don't want their emotions to rub off on me. I'm in a good place. So I don't want them to break down because I'm in a good place, And so it's like it's this weird dance that people do. It's like, I want you this close, but not that close.
Right.
And I want to share, but I don't want to share.
Right.
Yeah, it's very interesting.
So, and just to speak on what Clarice and actually you were saying too, Benita, a lot of times when you actually get the cancer diagnosis and people are very, very private, it's more so to a point they don't want to be a burden to anybody. Yes. And I like how you said that they feel that people are looking at them different. It is about pity. They also want to feel that I have to be strong through this, because depending on how you view yourself as a strong person, to them that might be a sign of weakness or something to that nature.
Absolutely.
So that's a lot of times why people often feel isolated, or they withdraw from their actual support system and their family. And then also just the family trying to be there for them, not understanding that, sometimes you got to let that person process it. I like how you said that, depending on what stage they're in. You have to give that person time to process it and meet them again where they're at. And yes, asking them all the time, how you doing and different things. To them, people start to get angry because they say, I have cancer, I'm upset.
Right.
So what do you mean? I'm about to die. So
how do you think I feel?
Yes.
How do you think I feel? Come on.
So oftentimes, that's a lot of times with the families, when I have them in the room with the patient, that is what they say. I'm just tired of people asking me, how do you feel? I have cancer. I am going to die, So I try to help the family with that standpoint of educating, just say, we have to go back to a sense of normalcy. I get it. It is not normal because the patient does have cancer. Your life will be forever changed. But it's still, I want the patient to feel that day to day that we can still have a casual conversation.
Exactly.
And it doesn't have to be about cancer.
It doesn't have to. That is so interesting, and that is important. Let me give the number one more time. It is 757-823-9110. Are you a breast cancer survivor? Has someone in your family survived cancer? How did your life change? What did you do to overcome that and to come to a healthier state emotionally as well as physically? 757-823-9110. And that is, ladies, a fine line to walk. How much should I keep asking, can I help you? Can I help you? Versus if I stay too far away, it's as if I don't care about you. I know my father, when he became sick, he didn't have cancer, but he became sick and frail. He was getting older and frail, and he started to stumble. And I'd say, Dad, tell me how to do this. He said, this is how we're going to do it. If I need your help, I'll ask you. If I don't, leave me alone. And I had to say, okay, because every mom was like, are you okay, Dad? Are you okay? Are you okay? And he got tired of that. Yeah. He really did. So there has to be the balance between the patient with cancer and the family members or the support system.
Right. Yeah. It definitely does. It definitely does.
So we've defined cancer. Now let's look at detection and stages, okay? Because I really want our listeners to understand. So a person finds out that they have cancer how? Self-breast exam, through their mammogram, ultrasound. How do many women find out that they even have cancer?
Most of the time, diagnosis. So, and you may have heard this more recently, the recommendations are for women to actually start. They're saying we're moving away from so much self-breast exams or clinical breast exams, but more so the focus is on mammography and early detection. And at this point, it's recommended your average risk woman to get screening between the ages of 50 to 74 every 2 years.
That's interesting.
But if you have any change in your family history, you need to let your doctors aware of that. So if you had a relative diagnosed with breast cancer at a young age, and when I say young, I say 50 and under. That makes a lot of people happy.
Makes me happy.
Yes. And so that's the more traditional way of finding out that you have breast cancer is through imaging. But there are some practice that still preach self-breast exams. But keep in mind, when you feel a breast lump, a lot of times the reason why we moved away from self-breast exam is because everyone who felt a lump went red flag, oh my God, it's breast cancer, right? Keep in mind, 80% of women have lumps in their breast, you know, and so what we preach is that be mindful of those lumps. What do they feel like? And are they the same on both sides?
Right.
And just constantly know your body. Know if there's any changes going on, if there's any dimpling, any redness, those things that you just want to talk to your doctor about.
I find it very important that you say know your body. And Ms. Poole, you're probably important with that part as well, because a woman has to feel confident that when she does go to a physician, that she's listened to.
Right.
That she says, I know, I feel this way. I've lived with the same body for many, many years.
Right.
And you want a patient advocate, or you want a physician to say, I hear you. I understand you. I do put credence in what you're saying.
Right. And that's a lot of times with, like you said, Benita, is more so with the confidence standpoint of and going to the doctor and then realizing that it's a possibility that something's wrong. You do oftentimes become your biggest advocate for yourself because you know your body, you know how it changes. So a lot of times that is sometimes how a patient is actually directed to actually get more testing, because sometimes you can say, oh, well, it's really nothing. The doctor just saying it's just dents and different things. But patients know how their body changes. So it is important to be aware of your physical changes of your body and to not just ignore the changes.
That's right. And speak up for yourself.
Speak up for yourself.
Because
definitely.
many times, even historically and in modern times, but not as much, women back down sometimes. Oh, he must or she must. They're the doctor. They're the expert. They must know more than I do. And so they're probably right. But sometimes you have to say, no, absolutely not. I absolutely need to know this. So we defined cancer. We looked at how you find it. Tell us the stages of cancer so we know. What are the stages?
So breast cancer stages are from 0 to 4. 0 is what I defined earlier as the ductal carcinoma in situ. That means those cancer cells are confined. They have not moved out of their borders. So that's a stage 0. And then you have stage 1. Now keep in mind, there's not just a stage 1. You have 1A, 1B, right? Then you have 2, and then they break that down as well. And then you have 3 and 4. Okay? And so those stages have everything to do with the size of the tumor.
Oh,
okay? The grade of the tumor, and then we talked about it before, the receptors. Is it estrogen fed? Is it progesterone fed? Or is it HER2 positive? That's a growth factor. That's a protein. So we want to know all of those things before we can properly stage it. In addition, some people are recommended what we call a staging workup, where we look at other organs, because breast cancer is very predictable. We know where it's going to, if it goes other places, we know where it's going to go. It's going to go to either the brain, the bone, the lung, the liver. And so a lot of times we do those staging workup to see if there's cancer there, because that also helps us determine if it's a 0 through 4.
Absolutely. And obviously there are different treatment methods depending on those stages.
Absolutely. So traditionally, breast cancer treatment is surgery, chemotherapy, radiation, and some women take what's called an anti-hormonal pill. And so it depends on your stage what treatment fits for you. Okay.
And Ms. Poole, do you counsel women differently depending on what stage they are, or just based on who they are personally, or a combination of the two?
Well, the discussion is different depending on what stage they are.
Okay.
But as far as what I offer in my services that we provide at Virginia Oncology, but more so as me as their social worker and advocate, I do it across the board the same. It's just everybody's unique to themselves. So I have to kind of see what is the actual barriers or what is the actual need. So everybody is going, most of the time, everybody is different in where I need to meet them at. So what I provide for them as far as overall is who I am, is to let them know that I am a part of your support team and I'm going to take the best care of you through this journey. And as far as the services that you're going to get, it's just going to depend on what exactly the need is.
Absolutely. So let's talk a moment about what you do exactly, a nurse navigator, and then as the patient advocate, just a little bit more in case someone is just joining us. Again, if you're just joining us, this is Hampton Roads Voices. I'm your host, Benita Adams, and we're talking about breast cancer. Please call in and give us your breast cancer survivor stories, any questions that you might have, any comments that you have for us, 757-823-9110. So, Ms. Johnson, let me, for someone who is just joining us, tell us exactly what a nurse navigator is.
So Centera employs what's called nurse navigators. And so if you're diagnosed with a cancer, regardless of the cancer, whether it's pancreatic, whether it's lung, whether it's liver, regardless of the cancer, you have the opportunity to have a navigator. Essentially, a navigator is a bachelor nurse who has gone on to get accreditation in oncology nursing. And basically what we do is if you think of the term navigate, right?
That's exactly what I thought.
We essentially sit with the patient most of the time at diagnosis or soon thereafter and just review with them, make it make sense. What exactly do you have? How do we treat it? What we do a lot of times, we do a lot of barrier assessments. So if there's a problem finding transportation for our patients, we work alongside Virginia Oncology with their social workers and with the social workers within, just to make sure that there are no, my goal is to get them, I say, across the finish line, right? So we just work hard at just being their cheerleader, checking in on them. A lot of what we do is phone calls. Hi, how are you doing? How is treatment? Do you have any questions or concerns? A lot of what we do are liaisons between the physician and ourselves and the patient, because keep in mind, and everybody can agree, when you go see your physician, you just go blank. When you see that white coat, your mind go blank. A lot of times
it can be a little intimidating though sometimes.
They call it the white coat syndrome. And so my goal is just to keep the dialogue going, just to keep, I like to tell patients when they get breast cancer, I just gave you a pink car, but you're the driver.
Right.
Nobody else drives this car but you. And so just keeping them in the driver's seat. One of my mentors said, you take this disease where it needs to go. And so that's really important, just affirming them and just being that resource and connecting them to local resources. So I may call them maybe once a month, but just connecting them with local support groups, just to keep that conversation, keeping them included and heard.
Absolutely, which is such a critical part, which is so much connected to what you told us what you do.
Right.
But again, for someone just joining us, tell us again what you do.
Well, I'm actually the oncology social worker, patient advocate, and more importantly, what I do is try to make sure that the patient has emotional support, and I make sure that I identify resources such as like Carice does, and also I'm actually helping with the coordination of care. I'm actually with the communication. I'm helping with the communication with the doctor. So it's a lot of different aspects of what the social worker does, but more importantly, I'm just making sure that they have a sustain a quality of life through this, because that's what's very important. A lot of patients, well, everybody that we meet that does have cancer, their life has changed in one way or another. And I got to make sure that I'm helping them to identify what are going to be the needs to make sure that they are able to continue with their quality.
Now, do you meet with them personally only or with family members? Because we've talked several times about support systems. Do you meet with family members or support people also?
Yes. So oftentimes I do meet with I actually meet with the patient, but a lot of times the actual family members are the ones who are referred to me because they have questions. They need to know how to cope and manage with the patient. So a lot of times it could be the patient, it could be the family member, it can just be an actual caregiver who's just maybe bringing the patient to their appointments, who notice some different things that they want to address. So actually we have appointments for anybody that's going to need support through this.
I like that because that's such an important part because the person you were mentioning perhaps feels isolated anyway.
Right.
And if you can help connect the patient and the family members who are the support system, really that helps a lot.
Right. And a lot of times when we are together, when it's just the family members, because I do disclose that with the actual patient, that the family has reached out, I talk to them about that. And a lot of times when they come see me, it is about communication. They feel like, they're withdrawing, our relationship has changed, and we talk about ways to help them cope and manage through that. So that's a big issue.
That is a big issue. Yeah. So again, we're talking about breast cancer, 757-823-9110. When we come back on the other side of the break, we're going to take your call, 757-823-9110. This is Hampton Roads Voices on Hot 91.
Is Hampton Roads Voices on Hot 91.
If you're just joining us, I'm Benita Adams, and we're talking about breast cancer and relationship to Breast Cancer Awareness Month, it being October. We're having a lively conversation with our two in-studio guests, Rashonda Poole. She is from Virginia Oncology Associates. She is an oncology social worker and patient advocate. Rashonda, thank you for being here today.
Thank you for having me.
And we also have in studio Clarice Johnson. She is a nurse navigator, RN, BSN. Thank you so much, Clarice.
Thank you, Benita.
All right. Now, we've talked about what cancer is and some various things. And then I asked both of you your roles. What do you do as a nurse navigator and also as a social worker patient advocate? But Ms. Johnson, you told me during the break, which I did not know, that you're actually a breast cancer survivor yourself.
I am, Benita. Yes, I was diagnosed in 2015.
Tell us your story a little bit.
Well, I noticed a lump, I would say actually it was Christmas Eve. Christmas Eve, I noticed a lump on my breast just by self-breast exam. And I noticed that particular lump didn't feel like the normal lumps I've always had and always felt. And so I made an appointment with my primary care doctor, and my primary care doctor said, "Oh yeah, I do feel something. What's your family history?" So at that point, I only knew that my Aunt Margaret, at 50, had breast cancer. And so she was like, all right, well, nothing big. Let's just get an ultrasound. Because anytime you feel an abnormality, they usually go for an ultrasound, right? So I went, especially because I was just 29 years old. So I went to get an ultrasound. And on ultrasound, they said, we need to get you in this to get a mammogram. And I'll never forget hearing that, and my background being a nurse, nurses we jump the gun a lot. We're like, oh no, what is this? What is this? So they said, you need a mammogram. And I'm like, okay, well, we called your doctor's office, and your doctor, we need a prescription for it in your doctor's office. They haven't sent it, so we'll give you a call. Benita, I literally got in my car, rode right to my doctor's office, which is around the corner. And I said, hey, listen, I need a mammogram. Can you go ahead and give me that script? Sure enough, they gave me the script. I went right back to the same imaging center after I got the ultrasound, and they did a mammogram. So after the mammogram, the radiologist pulled me in his office, and he said, listen, we're going to recommend that you get a biopsy done. And so he recommended a biopsy. And again, this was right after Christmas Eve, along that time. And I was diagnosed with breast cancer on January 7th, 2015.
Wow. Amazing. And so we have one caller on the line. Let's go ahead and get that call. Caller, you're live on the air. What is your name, please, and where are you calling from? Hello, you're live on the air.
Hello?
Yes, you're live on the air. What is your name, please, and where are you calling from? If you choose to give
Greta
your name.
from Virginia Beach.
Hey, Greta, how are you?
I'm doing okay.
Good. What's your question or comment, Greta?
Well, my comment is that I am a survivor. I feel okay and everything, and I just want to make a statement stating that when you're going through that and when you see people that's for you and everybody is waiting for you to get to that goal line is just a wonderful thing.
And that's, how can you encourage other women who perhaps are in the similar situation to just be encouraged to get to that finish line, to stay positive as much as they can? Of course, that we all have up and down times. We know that.
Yes. But, you know, I think of it like I was taking vitamins when I had to do my chemo treatment. And I just looked at it that they was helping my body to heal. And I just kept a positive attitude like that. I didn't think of death. I thought of living. I started making vacation plans to go to Hawaii or do something that I always wanted to do, and I never did think about not making it.
Right. And always looking ahead that you have a future, that you had a future and have a future, as opposed to that's it. I'm done.
Yes.
Wow.
I just kept having that future, and how the social worker did help me. And when she told me that my life was going to change at that time, I didn't understand what she was saying, but then what it did, it put a new energy in my life, you know. So and I really appreciate that too.
Absolutely. Well, Greta, thank you so much for calling, and that's a word of encouragement for other people who are listening today.
All right. Thank you.
Okay, you're welcome.
Bye.
Now, Ms. Poole, it's interesting that she said that she kept a positive attitude, and that has to be such an important part.
Yes. A lot of times when I'm with my patients and they are seeming like that, you know, mentally this is taking a toll on them, we talk about positive reinforcement. We talk about positive affirmations. We talk about things that encourage them. We even visit, and I always discuss with them, I said, you know, I know that this cancer diagnosis has changed, will forever change your life, but I want you to think back to when you had to have that fight or flight attitude. And I want you to apply them same fight or flight survival techniques. I want you to apply that right now for your mental state, because it's going to be very, very important for you to continue on with your quality and also to thrive through this, because mentally it takes a toll on people. Just how they feel, you know, you need that kind of positive reinforcement to get up daily. I mean, everybody does. I mean, to come to work or to go to school, especially when you don't feel well. Oftentimes we have obligations and we still carry on. So I talk to my patients about that to help them to understand that we can do this as well.
And that's so interesting, because you have to think that's an extra layer.
Right.
If the normal layer is just today is Monday, Friday, whatever,
Right.
and I don't feel like going to work, then you add a cancer diagnosis on top of that.
Right.
And you're trying to get out there and live and do and not have the pity party and not all those things. That is exhausting sometimes.
Right. It is very exhausting. I look at them also as, you know, not only are they survivors, but they're inspiring, right? So when we're having hard days as well, people that have not been diagnosed, you look to them for your actual strength as well. So I oftentimes refer to that to say, you're my strength as well. I come in here daily for you.
Absolutely.
Right.
So Ms. Johnson, you were saying with your story, how did you keep yourself motivated? So you went and you had an ultrasound, you had a biopsy. Okay.
So then I get the diagnosis. Keep in mind, Benita, I failed to mention, married, a 14-year-old, a 1 and a 2-year-old.
Wow.
And so we didn't mention it, but we kind of did. You know, breast cancer is a family disease, right?
Yes. Wow.
And so being a mom, you know, trying to go places within my career, I'd say it's almost like juggling, right? And I think all women can relate. We all juggle all these different things. But when you're diagnosed with breast cancer, it's almost like someone throwing in a bowling ball.
Wow.
I can't juggle a bowling ball. Can you, Rashada? Can you?
No.
Not
at
possible.
all.
Wow.
And so that's what I compare the diagnosis. It's like, okay, now I have a bowling ball.
Wow.
And so what my encouragement, what my motivation was, so I had to one, recognize that I had limitations. You know, I think just being young and just being the person I was, I failed to ask for help. I thought that was a sign of weakness. And so I'm doing all these things, but not really asking for help, and just really putting a lot of burden on myself. And so that just taught me I had to stop, because again, I can't juggle a bowling ball. And so my motivation was of course, my community, my church, my friends, but just allowing people to come in, allowing people to help. I think that was one of the things that I learned the most is just it's okay to need help. It's okay to not feel. But my motivation truly was my family, my kids. And one thing I encourage young people, mothers who go through diagnosis, it's like, you take care of you first. Yes. And we talk to moms about this all the time. You first.
All the time.
Self-care. Yeah, it's so important. So, you first. Those children are going to be fine. Children are so adaptable. Oh my God, they're so resilient, And so, that was one thing that I had to constantly do. But also, I did not want to stop memories from being made, because we can all, your children grow up. And so I was like, well, my kids are only going to be 1 and 2 at this period. And so I still had to enjoy those moments. So there's a picture I laughed, my daughter going to her 3rd birthday. We were going to Chuck E. Cheese and I got this wig on and it's all shifted. But you know what? That's where I was. And that was my reality in that season, and I couldn't rob her from celebrating her 3rd birthday at Chuck E. Cheese, and so those were some of my motivation. My son in his basketball games, going to those games. And of course I couldn't make it to all of them. Right. But also developing those boundaries, learning how to say no was one thing I learned in my process. It's like, it's okay to say no.
It's okay to say no.
But, those were definitely, my motivation. And one thing I did too, my mentor said she would call me and she would ask me, how's your husband? Well, did you call and speak to me or my husband?
Right.
And I had to continue to remind myself, you're still married, and so it's all these moving parts that you still have to address.
Yes.
But it's very attainable.
Right.
It's very attainable.
And I want to reiterate this, if you ask for help.
For sure.
If you have, as Ms. Poole said, that support system.
Right.
And it's not a sign of weakness to say, today it's just not my day. I think
Right.
we all need to know that, to be able to say that, but especially in this situation.
Right. And that's a lot of times when I am meeting with my patients, that is what I give them, that open platform to say that today is not your day. I help them tell their family member that while they're there, because they have maybe voiced that to me in a prior visit.
Right.
And I said, let's talk to the family. And they said, well, can you help me communicate that to the family?
Right.
And they said, today I'm just having a bad day.
I'm having a bad day.
And they feel like they can release it. I'm having a bad day. And I want to speak on what Clarice said about just how she said her motivation and just more so not wanting to feel like it's a burden. I mean, that is mostly a lot of times what the patient is actually thinking. So we as their support system have to be there for them and communicating to let them know that it's okay for you to be who you are in this very moment. So I like how Clarice said that, and that's how she had to own it.
Yes.
And that is very important, accepting.
About.
You have to own it. So we do a lot of that as the social worker, helping them to own that and to process it. So
And perhaps not feel guilty, because
Absolutely.
I'm having a bad day. Maybe it's an emotional day. You might be angry. Why did I get cancer?
Yes.
What did I do?
What did I do?
What did I do?
Right.
But Nina, one thing I tell people, they're like, I don't know how to ask this. I have a good friend, right, who enjoys cleaning the house, right? Loves cleaning, right? So here it is. I'm going through treatment. I've got this big old family. I am done. Oh my God. And you can only clean your house, and I'm like, I'm suffering. A week goes by and I know that's her gift. I know that that's what she loves and enjoys, but I'm so prideful. I didn't reach out and say, hey sis, can you just come over and just please just dust? She would have loved, she didn't want to make a casserole. Right. She didn't want, that's not her gift, but she can clean from top to bottom without breaking a sweat. And that's her gift. And so sometimes we don't allow people to operate in their gifts.
Right.
Because we want to do everything.
We want to do
and we okay. And you're not.
You're not okay.
We want to keep on our superwoman cape.
Sure.
Right.
I can, the WOMA, and I can bring home the bacon, put it in the pan, and never let you forget your. I can have cancer, taking care of the 1-year-old, the 2-year-old, the 14-year-old. I can still go to work. Some days you just can't do all that.
You can't do all that. And to speak on what Clarice said is more so recognizing the talents of what everybody can bring to the table. Yes. And you got to identify that. And like she said, just asking, well, I know that she likes to clean. So just maybe saying, can you come clean? And oftentimes when the support system, because they don't know how to help you, that is the way they can help you.
Yes.
They just saying that, saying, hey, can you come clean? They feel so like happy, like I'm actually doing something. Right. Not directly saying the words help, but do you mind coming to clean? So a lot of times it's kind of recognizing your own support system strengths, and just identifying that and asking for that help. Can you cook a meal today for me? Stuff
right.
like that is daily what a patient actually needs.
That is their gift.
Yes.
Right. That's their calling. That's their way. As you said, can't cook a casserole, but I
Right.
can clean the house, or I
Right.
can watch the children.
Yes.
So
Yes.
you can take a nap.
And
Right.
you know that one friend who could have the kids and you know they ain't safe, and then the
Right.
other one like, oh, no.
Right.
Or you have that one friend you could
Yes.
cook, and then that one, you can clean,
Right,
And
right.
so you know this about your friends. You
Right.
know this about your family.
Yes.
Right.
So why not?
Why not?
Right.
That is the support that you need. I also like when our caller Greta called in, and she said that she kept as a vitamin her positive attitude, and that she looked at making plans for the future and saying, I'm going to go to Hawaii in 2 years, or I'm going to do this, or I'm going to do that. How important is that, Ms. Poole, to think future?
It's very important because it helps the patient to look forward to everyday life, and then more importantly, that it's not, to them, it's not a sense that I'm giving up. So if they start to plan things for the future, it's in their mindset, it's like, I'm not giving up. I know I'm going to be here. I'm planning for tomorrow. I'm planning for the future. So it's more so of a mindset of, you don't want to feel hopeless. You don't want to be like, oh God, I'm going to die.
Right.
So a lot of times, a lot of patients do that. And we do encourage that, because at the end, a lot of times doctors don't like to give that type of prognosis of when your time is up. So a lot of times we continue on in discussing futuristic things until it comes to that point when a doctor feels that it's time to have that end of life discussion.
And we'll talk about that in a little bit, but how did you keep that positive mindset? Your family was, some people call it your why. You said your motivation.
Yeah.
Your why to keep going, your why to keep fighting. How did you keep a positive attitude? Obviously, we all have down days. We've mentioned that.
Yeah.
But how did you keep going?
I think being very strategic in what I was feeding myself. So I'm a believer, and so I was very careful of the songs that I would listen to or the messages I was receiving, right? And also the people I was receiving them from. One thing I had to do to keep myself focused, if you will, it's almost like going through a course, like a school course. You got to keep your focus, right?
Yes.
And so one thing I would do is be mindful of what I was receiving, but also what I was looking at, right? So I was a nurse. I worked for Centera. I've always worked for Centera since 2008. And so I would know survivors who are in high places who were doing their thing, who were showing up to work and doing it well, and they were 5 years out, 10 years out, and so I was just surrounding myself by those faces, so that's one of those encouraging things that I continue to do, is just keep myself surrounded and knowing my boundaries, knowing what I couldn't do. One thing I could not do, I could not look at blogs, because that would just put me in a tailspin of, oh my God, what if I get this? And so I had to limit those kind of influences.
Focus.
Yeah.
Well, we're going to come back and continue with that story. Again, we want to hear from you. This is Hampton Roads Voices, and we're talking about Breast Cancer Awareness Month. Give us a call, 757-823-9110. Stay with us after the break on Hot 91.
Is Hampton Roads Voices on Hot 91.
Welcome back, everybody. I'm Benita Adams, and this is Hampton Roads Voices, where we speak life into our communities. Today, we're talking about breast cancer in relationship to Breast Cancer Awareness Month. We have three guests, someone joining us new right now. First of all, in studio, we have Rashana Poole. She is an oncology social worker and patient advocate. Then we have Clarice Johnson, a nurse navigator, and now joining us on the line, we have Candy Bryant. She is a 3-time breast cancer survivor. Candy, thank you for being here today.
Thank you for inviting me, Ms. Bonita.
Now, we've been talking in the last hour or so just about the overall notion of breast cancer, what it is, how important it is to have a support system. But tell us a little bit about your story, Candy.
Yes, ma'am. Well, first of all, like you said, I had breast cancer 3 times. The first time was back in 2003. I found it by doing a self-breast examination. By having a self-breast examination, went to the doctor, and of course, it came back that I had breast cancer. Had my mastectomy. Once I went through the healing process, I had 8 rounds of chemotherapy. And of course, with the chemotherapy, that was not easy at all, being sick and tired and not really having a lot of energy. But I was able to get through that. went through my breast reconstruction, and was able to move on. As time went on, breast cancer came back again, 2012. This time it hit me in my left breast. I found it by being at home, changing linen on my bed. I saw blood drops on my bed. At first I thought that I had a nosebleed. Went to the bathroom, checked myself out. I said, okay, my nose not bleeding. So I checked all over my body. I noticed that I was bleeding from my left breast. Had to call the doctor, went in for a mammogram. Of course, I came back that I had breast cancer again in the left breast. Had surgery, another mastectomy. Had a procedure where I want to say to you, well, I had a tissue expander put in, and when that tissue expander was placed in, I went through my radiation treatment. And as I went through 33 rounds of radiation treatment, I developed an infection with the tissue expander. And from there, I had to have the tissue expander removed. I even went through a period where I had to go to a hyperbaric clinic, so that I can have treatments there because of the infection from the tissue expander. That was removed, went through the process where my body had to heal from that. Then I had breast reconstruction. This particular time, I had a procedure called transplant, in which where my breast was built from tissue and vessels from my own, body. That way I have natural breast now. So please excuse me if I sound a little nervous, but
that's okay. We're just here having our conversation, and we appreciate you being with us.
Thank you, ma'am. And so as I went through that process, things was going well. Time went on, breast cancer struck again a third time.
Wow.
And again in the left breast. And this time I found a lump doing a self-breast examination in the shower. Called my doctor. At that particular time, they thought it was something called necrosis, in which where they thought it was like lack of blood flow, that I wasn't getting properly, from the breast reconstruction surgery that I had. So, of course, they wanted to do a mammogram to make sure that it wasn't nothing else. That came back that I had breast cancer again.
Wow. And you had to go back through chemo and radiation after that?
Well, the third time, thank God, I didn't have to have any treatments at all.
Okay.
No treatments at all.
Amazing. Ms. Johnson, how common is something like that?
Not too common when after we remove with the mastectomy. Keep in mind we're removing 95% of the breast tissue. So the goal is, of course, survivorship, and so our intent is to take as much of the breast tissue as we can. And so a mastectomy doesn't ward off cancer. It's just a local reoccurrence that we're taking away, but it doesn't diminish the chances of it coming back wholeheartedly. So I don't know the exact numbers, but what I wanted to mention, I really do applaud you, Candy, on doing a couple of things. After, because that's the assumption that a lot of women make. I had a mastectomy. I'm going for the mastectomy, right? And then they fail to follow up. The fact that she continued to do breast exams after having 95% of that breast tissue removed is A+ on her. And another thing she missed it. You're welcome, Candy. And then the other thing, the bloody nipple discharge. That is not something. That's something that we don't see as often, but it's something that we definitely want to look at closely. That's not the telltale sign you have breast cancer. So for listeners, that's not a telltale sign, right. But it is something that you need to have a doctor look at. Okay, right. But just your follow up, Candy, is just exceptional. I really do applaud you for listening to your body and stepping up. But no, I can't say there's no number to support that happens quite often.
Right.
At least I've never seen it.
Right. Now, Candy, we talked about in this pool. I'll come right to you. We talked about support system. Who was there for you during this time?
wow. My family, my mother, she definitely was a strong support. She made sure that I got to my doctor's appointment, made sure that I was eating properly. I don't care how old you get, mama's always going to check on her child. So she wanted to make sure that I was all right. And then on top of that, my son and my daughter, by being in the household with me and, at night being sick and not being able to do anything, they were there for me. They seen the good, the bad, and the ugly. Absolutely. And, just other support and family and friends. I had a strong support group.
And Ms. Poole, of course, we've talked about that.
Right. And first and foremost, I want to agree with Clarissa. I want to say, Candy, thank you for being just openly transparent about your actual experience and actually your journey through this. And I applaud you as well, just for your strength. We can definitely hear that through the phone. Right, and we can just see that your determination and understanding of your body is a lot why you are a survivor. So, it's important that with you sharing your story and the things that you describe, kind of like what Benita said, is how important the support system is, but also just knowing that the changes that you were going through, you continue to fight on. So I definitely want to applaud you for that. Thank you.
Thank you.
Now, Ms. Johnson, she mentioned a couple of things that I want to ask you about from the clinical standpoint. A tissue expander. Explain to our audience what that is. I want to make sure they're understanding this whole story.
Perfect. So remember, when we're removing 95% of the breast tissue itself, what we want to do is create a pocket, if you will, to put a permanent implant. Keep in mind, when women do breast augmentation, breast enhancements, right, they're putting generally implant on top of muscle, but we've taken that entire muscle out. Oh. So we want to rebuild that muscle, right? And so that's why we expand the tissue. Imagine almost like blowing up a balloon. Mm-hmm. That's essentially what an expansion is. We're blowing it up, and usually we leave it there for about 3 months. And then we do an additional surgery to remove that expander to put in a permanent implant.
Okay.
So it's a 2-part series.
Oh, okay. Okay, I understand that. And so she mentioned that. I thought that was very important. Mm-hmm. Now, Candy, in terms of, so this has happened 3 times. So you mentioned nutrition and eating and so forth. Emotionally, what was going on at that time?
A lot. Each time I heard the word cancer, I felt as though that I was just given a death sentence.
Wow.
So, of course, my emotions were up and down all the time and not trying to put all my business out there at one time. But during the first time, when I was diagnosed with cancer, my marriage had failed. Mm-hmm. And then I had lost my dad, to cancer. And so my emotions were just all over the place. Mm-hmm. There were times where I didn't even think that, I was going to make it. There was times where I just wanted to just give up. Mm-hmm. I didn't care because of the way I was feeling at the time. But I thank God because at my lowest, he had always had a ram in the bush. He always had someone to call me or, just come by. Or just text me, just to uplift me. Because, my emotions was just all over the place.
Mm-hmm. And what did you do emotionally? And Ms. Poole, I'm going to ask you to reiterate some of the things you mentioned, like affirmations and so forth. But what did you do emotionally to keep yourself settled? Obviously, we know we all have bad days. Is something that you read or didn't read or your faith? What kept you to have some sense of balance emotionally?
To be honest with you, my kids.
Okay.
I knew that I had to survive, if not for myself, but for my kids. Because I did not, even though I wanted to give up, and that's what I was saying, but deep down inside, I didn't. Because, their father was already gone, and, and to them, they were scared. So I knew I had to step up to the plate. I knew that I had to fight. If I didn't fight for myself, like I said, I had to fight for my kids. So I had to pray. I was doing a lot of reading. I was in the gym working out. I was taking walks, on the beach. I was doing what I could do to survive because I did not want this thing to beat me. I wanted to live.
Absolutely. So I'm going to ask both of you here in the studio, how important is the nutritional piece along with the medical piece? I'm going to start with you, Clarice. How is that such? We understand the medical part, but how does that fit in there?
So keep in mind, chemotherapy, its goal is to destroy all rapidly producing cells in your body, the good and the bad, right? So that is going to take a lot of your energy and your drive. And so I tell women, you can see the research, they talk about plant-based diet, right? And so we get women who are like, oh, I'm going to be plant-based diet, no meat, no dairy, no cheese. And then it's almost like it's like a roller coaster, it's crash and burn, right? So we talk about everything in moderation. So if we're giving you something that's taken, you've got to consume something that's going to give. So it's just practical, and so I think it's important just for your day-to-day energy. So if you're taking that chemotherapy is taken, you've got to replenish yourself with the proper fluids, vegetables, fruit, protein, those things that are going to add, not fried foods and a bunch of sugars, those things. But again, in moderation. I'm not saying completely eliminate that. Right. But just everything in moderation. If you want a cake one night, a piece of cake, okay, but don't make that your whole plate. Right. You understand what I'm saying? Right. So you've got to give your body the proper nutrition so you can fight, so you can get up and take that walk. I guarantee you she couldn't take that walk if she drank a whole thing of soda and had a bunch of chips and a bunch of cakes. Right. You wasn't walking. True. Right. Absolutely. So Candy, you changed your diet as well as your mindset, as it were.
And everything she said is true. You have to, because if you don't, then I wouldn't have been able to move around, like I wanted to. Yes, ma'am.
Right. Is that something, Ms. Poole, that you talk about too?
We talk a little bit. We definitely talk about dieting and nutrition and different things and the importance of your diet and getting through this chemotherapy, because something like what Clarice did say is just more so that's where you get your energy from. Right. That's where you get your energy from. So we definitely do address the diet and nutrition, and a lot of times refer out to a nutritionist if needed.
Excellent. And I like that you said that you have to do that part because so much is coming out of you. So much is taken. You've got to replenish that. So we're here talking about breast cancer. Our number is 757-823-9110. We have Candy Bryant with us, 3-time breast cancer survivor, Clarice Johnson, who is a nurse navigator, and Roshonda Poole. She is an oncology social worker, patient advocate. We want to hear from you, 757-823-9110. This is Hot 91.
Is Hampton Roads Voices on Hot 91.
Welcome back, everybody. I'm Benita Adams, and we're talking about breast cancer with Roshonda Poole, Clarice Johnson, and Candy Bryant on the line. Now, Candy, right before the break, we were talking about what you were doing to stay healthy. We talked about the nutritional piece, but we did also talk about sometimes a person with breast cancer, they feel isolated. How did you feel in terms of having to share this information with your loved ones?
Well, for me, in the beginning it was hard, but I knew that I had to tell them. The hardest part was telling my mom, and because I knew that she was going to be upset, and the other part was telling my son and daughter. Okay. That kind of news I just couldn't keep to myself. I shared with the most important people first, and then the next day I had to let everybody else on the job know what was going on. So I wanted people to know, what was going on, so that I can move on to the next step.
And what type of reactions did you get? I would assume, obviously, support and so forth from your mom and your children, but what reactions did you get overall? Did they feel sorry for you? Did they readily say, I want to help you? What did they say?
Well, I believe that everybody was scared because my family, because what happened with my dad, we had just lost my dad. Everybody was scared because they didn't know, okay, is she going to live from this, or is this cancer going to take her away? And pretty much everybody was, their their reaction was based on mine. So I had to stay strong, even when I was telling them what was going on. And even when I told the ladies on my job and my friends and everybody what was going on, they didn't feel sorry for me. Everybody wanted to help me. And they just surrounded me and just asked, what can I do to help? You know, I want to pray for you, or can I go to the store for you, or whatever needs I needed, you know, they let me know that they was going to be there for me.
Okay. And was it challenging for you to accept the help, or did you readily accept the help? Because sometimes, as we were talking, some people want to be superwoman all the time, and they say, oh, no, I can do that myself. How is it for you?
Well, for me, it was hard for me to step back, you know, because I've always been used to doing things on my own, but I had to step back because I know what I was getting ready to go through. I knew I needed help, and, you know, and I was willing to step back and let people help.
Absolutely. Now, Clarice, Candy mentioned that she had a mammogram, but I know, and as I was preparing for this show, there's ultrasound and there's mammogram. Is one more effective than the other?
So they all kind of complement each other. And I'll explain the clinical part, and then I'll you know, like layman's, if you will. So traditionally, women who are 30 and under, they have really dense breast tissue, right? So they have these dense breast tissue, and in addition to the densities, they have a lot of milk ducts, right? So oftentimes we do an ultrasound because the ultrasound will tell us if it's a solid or fluid filled. That doesn't tell us if it's cancer or not. The only way we can confirm diagnosis is if we do a biopsy, if we actually sample it, right? So for younger women, oftentimes we say 30 and younger, we're going to do an ultrasound. For older women, their breast is a little bit more meaty, if you will, and so mammography is the best picture. And then for other women, we didn't see it on mammography or an ultrasound. We actually saw it on an MRI or maybe a CAT scan or a PET scan. I like to think of like this. If I took a picture with my iPhone, okay, I see you, I see your picture. But if I bring a real camera in here, oh, I see this picture a little bit clearer, and I noticed that about that and that about that. So they all complement each other so we can understand the size and the extent of the tumor. Does that make sense?
That makes a lot of sense. One is clearer than the other.
Yeah, or just a different angle. Angle. It could be a different angle, or a clearer picture. But most of the time we do MRI. First and foremost, we like to do, for 30 and under, we got to do an ultrasound. For older women, we do the mammography. And if we seen an abnormality, we'll do the ultrasound after the mammography for the older women, and then kind of reverse. And then once we confirm a diagnosis, usually we do the MRI to get that really nice picture with more additional images.
Now, Ms. Poole, because you work so closely with the doctors and so forth, do you have to counsel women differently if the cancer was found one way versus the other, or that really has no bearing on how you interact with them and treatment and those kinds of things?
No, it doesn't have no bearing on how I interact with them and with their treatment. It's just more so depending on the need, or what actually stage they're in. And when I say stage, I'm more so in processing it. So
okay. And Candy, you found yours. Yours was found all 3 times with a mammogram?
Yes, ma'am.
Okay, all 3 times. Now,
yes, ma'am.
We talked about your support system in terms of your your daughter, your son, your mom, and so forth. Continue with your story just a little bit. Okay, so it's the 3rd time. How are you feeling after finding out you have cancer for the 3rd time? Do you see it differently? Do you respond differently? Do you interact with your support system differently? Some woman out there, she a family member, they need to know that. How was it for you after the 3rd time being diagnosed with cancer?
Well, after being told this the 3rd time, I said, well, look, I said, and get me the 1st time. It didn't get me the 2nd time, so it's definitely trying to take me out the 3rd time. And that's pretty much how I was thinking. And when I left out the doctor's office that afternoon, I had a mental breakdown out there in front of my mom and my son and daughter. And I just told them that I was tired. I said, I just can't keep going through this. But I say, for some reason, there got to be a reason why this is happening a third time. But I'm not going to let it get me down. I'm just going to push forward. Mm-hmm. And my support group, as always, they were around me. Mm-hmm. They helped me every step of the way. And again, I did not keep quiet. I let as many people know that I had cancer, prayers and, just telling people, know your bodies, check your breath, that's where I were.
Absolutely. So, Clarice, let's talk a little bit about effects after treatment. Mm-hmm. Hair loss, weight gain, weight loss. Tell us a little bit about it. Then, Candy, I'm going to come to you and ask you personally. So tell us clinically what happens, perhaps, generally.
So going through chemotherapy, keep in mind, not every woman experiences those things, right?
Mm-hmm.
So we have really hard chemotherapy treatments, and then we have a little bit milder chemotherapy treatments. And so most common, right? We see the hair loss. We see the mouth sores and we're diminishing all rapidly producing cells. And so you have rapidly producing cells in your mouth.
Really?
And your
Mm-hmm.
GI tract, and then your hair. So you lose a lot of hair. You get the nauseousness, the aches. A lot of women compare it to like having the flu. Okay. Right. But keep in mind that's for a lot of women, that's usually the day, maybe like 2 days after treatment. So you get treatment. More than likely, women are getting treatment anywhere from every 2 to 3 weeks. So you get that treatment on Thursday, Friday, you're fine until about Monday, and then it's like, whoa, what just happened? Right? And so for the next about 2 to 3 days, you're dealing with these different symptoms, and as I said, every woman is different. And then you start feeling yourself. You start feeling better. And then you get back in that chemotherapy treatment center.
Oh my goodness.
And then it's like this cyclical thing, right?
Right.
And so that's just during treatment that I'm talking about, those different side effects that a lot of women. And then there are other things that we don't hear too common, but most of the time it's like people compare it to having the flu, just really not feeling up to doing much.
Which is really something, just as you're starting to feel better, then you have to do it all over again.
Sure, yeah.
Is speaking with you such a critical part at that time, Ms. Poole, right in there, or just overall?
Well, overall, but a lot of times, like what you're describing is the physical changes that the actual woman is going through, and a lot of times we identify with our hair. Some of our physical attributes is what makes what we look forward to, as far as our eyes, what defines us. So when a lot of times when women come in and they're losing their hair, that immediately triggers some type of depression or anxiety, and they don't know how to cope and manage. So it's more so like you have these physical changes. You're getting up every morning, looking yourself in the mirror. You don't see yourself anymore. Who are you?
Who are you?
Who are you? And when they come into me, that's the kind of questions they ask. They, a lot of women say, my hair, the doctor just told me I'm going to lose my hair. What am I going to do?
What am I going to do?
Or they come in, due to radiation or something to that nature, they might be losing their teeth.
Really?
What am I, I'm going to lose my teeth. If your smile is something that identifies you, that you are very prideful about, and how you start to have questions about who you are now. How do you move on? So a lot of times, and with that question, Benita, it's more so that at every stage we're constantly having that conversation, because I would not be able to identify until they're actually in how they're actually feeling or what has actually changed.
Right.
And a lot of times that's establishing that relationship, which I usually do with my actual patients, and I'm being able to feel that they can trust me enough to have this openness to say, Rashonda, I feel ugly, or I'm not the same, and I don't feel attractive. What do I do? So that self-image, you lose a lot of self-confidence.
You have to. I mean, just as women in the culture in which we live, we're considered, we're to be beautiful. Right. And then just as we age, we look at ourselves and go, oh my gosh, what happened? And then you put something like that on top of it.
Right.
Amazing.
Right.
So, Candy, as you saw yourself change, your body change and so forth, what was going through your mind? How did you cope with that?
Well, first of all, I just wanted to say what they said is the truth. And it's hard. With the chemotherapy, I lost every ounce of hair on my body.
Wow.
The chemotherapy, it makes you sick. So certain foods you smell, you get, sick to your stomach. And, and even looking in the mirror, like she just said, you don't see yourself. You just don't. You're looking at, who is this woman in the mirror? And, you're standing there looking in the mirror at this bald-headed woman with no eyelashes, no eyebrows.
Mm-hmm. And you're wondering, and that makes it very difficult and challenging, right, Candy? Candy, are you with us? I hear you. Okay.
Yeah.
Go ahead. Jump in.
I think one thing that helped in that whole process, my hair was down my back. Mm. And one thing I did, we tell some women, and I hear it a lot, like they'll cut it short, right? Mm-hmm. So then the gravity of just having all that hair come out, keep in mind, you're not losing it as soon as you get treatment. Right. They say 10 to 14 days after your first treatment, you start noticing, they say 100 strands of hair, you lose them, every day. And so, your hair will start shedding. Mm-hmm. And I remember my husband told me this one thing, and I'll always remember it. I took a selfie, and I was like, ew. He said, that's what you look like. Mm. And that's a part of the accepting process. Wow. And that's what I keep telling myself. But that's what you look like. And you got to live it and own it. And that's what I always say. It's like, and just keep in mind, this is just a season. I think what
that's right.
The beauty part of this is that it does rip all of those things that society has told us made us beautiful. Yes. And then you're literally staring at the person that you may have never saw before, right? Because you're so busy putting all of these other images on, right?
Wow.
And so it's actually a beautiful place when you realize, wow, that is me.
That is me, right? And beautiful, right? And so a lot of times that's kind of what I'm reinforcing. Mm-hmm. If it has to be that we look in the mirror together, and I ask them a question, "Who are you?" And then they start to look, and they say, "I am," and whoever the patient will recite their name, and they'll say, my hair doesn't make me, my smile doesn't make me, my eyes don't make, I still, and what we talk about is more so saying, one thing that it doesn't take from you is your heart.
For sure.
It doesn't change your heart. And that's one thing I kind of tell my patients. I said, you might feel that cancer has stripped everything away from you, but it doesn't change your heart. Mm-hmm. Who you are, that's who you are, is your heart.
And what's interesting on that is that cancer does not develop in the heart. Do you know that? Cancer develops in every other organ system.
Oh, my goodness.
But your heart.
So that's one thing
great.
Yes, that's what my mentor told me. The cancer would never change your heart.
Never. Oh, my goodness.
That is one thing. So that's kind of what I, is motivate my patients with when I'm talking to them.
Oh, absolutely. So we're going to take a break right now. Candy, your story is amazing to us, and we know that this is tough, but your bravery is encouraging all of us in this room, and I know a lot of our listeners as well. So again, we're speaking with Candy Bryant, a 3-time breast cancer survivor, nurse navigator Clarice Johnson, and oncology social worker and patient advocate Roshonda Poole on Hampton Roads Voices on Hot 91.
Is Hampton Roads Voices on Hot 91.
Welcome back, everybody. We're talking about breast cancer because October is Breast Cancer Awareness Month. And so we have on the line 3-time breast cancer survivor Candy Bryant. Candy, thank you for being here today and sharing your story.
Yes, ma'am.
And Roshonda Poole, Virginia Oncology Associates, oncology social worker and patient advocate. Ms. Poole, thank you again for being in our studios today.
Thank you for having me, Benita.
And we have Clarice Johnson. She is a nurse navigator. Ms. Johnson, it's a pleasure to have you.
Thank you, Benita.
Now, we don't want to end our show without talking about breast cancer in men, because we know that it does occur in men. And in my research, it said 2,190 men will be diagnosed with breast cancer, 410 will die, and that is our percentage. So talk a little bit about, should men do self-breast exams? Is it the same thing? Do their bodies respond the same? I'll start with you, Ms. Johnson.
So right now, it's interesting, when you go to your doctor, females, when we go to our doctors, generally like every 2 years, they do a clinical breast exam. That does not happen with the male patient. First, how often do they go to the doctors, right?
Right.
Especially for preventative care,
Right.
And so what I would say to the male listener out there is just to understand your family history. There's a 1% chance, it's the one, but nonetheless, that's a 1% chance that a male will develop breast cancer. Mm-hmm. But a lot of times it has to do with familiarity or genetic. So mom had the BRCA gene. Did that person get tested? And unfortunately for men, when they do get diagnosed, their stage is a lot worse. And when I say that, when we diagnose them, more than likely it's spread to maybe the lymphatic system, maybe an organ. It's a little later in stage when we do diagnose men, unfortunately. So I say to the men, of course, understand your body. We don't have a male breast exam, but understand your breast history. Understand your body, but also understand your family history.
Right.
And if you have a prevalence of breast cancer, especially if there's, again, that genetic mutation and if there's any male breast cancers in the family.
Absolutely. How do you counsel a man differently, or would you counsel a man a little bit differently in terms of what you do as the advocate?
Well, it's not as far as counseling standpoint, how I kind of establish what is actually the need for a man, because just from, as you would say, just from a man's perspective, one, I have breast cancer. This is like a stigma, is only women.
Right.
And then also to think that they have breast cancer and they have to go through chemotherapy and different things like that. They have other aspects or factors that's playing a part on how they are actually coping and managing it. It's more so they're very private. They are, more so they are supposed to be the strong one, the protector, to take care of their family. And all of them different components all of them different factors start to play emotionally on a man on basically, this cannot be happening to me.
Right.
This possibly cannot be happening. What am I going to do? Because they have, their expectations to take care of their family and do different things. So when I'm talking to any patient, and including men, that is kind of the major concern, is financial issues or concerns about how am I going to be able to, one, pay for this treatment,
right,
or how, for one, am I going to be able to sustain and take care of my livelihood and continue on. So with that question, Benita, it would be more so that it's just depending on the stage on how I'm going to actually talk to the man. But there are other factors that come into play just by societal issues.
Absolutely.
Right.
Absolutely. And Candy, were those some of your concerns in terms of how are you going to continue working and how were you going to manage your household? And then, of course, you were dealing with the, bereavement with your dad. Those factors, were they all a part of your thinking when you were diagnosed?
Yes, ma'am, it was.
Right.
Yes, it was. And one thing, once my job was informed about what was going on, they immediately told me that that was one thing that I didn't have to worry about. My health comes first. My job was going to be there. So I didn't have to worry about my job at that particular time. And like I said, my support system was just strong. They pretty much eased me at anything that I was worried about.
And I know you said that your dad had died of cancer. Was there any other breast cancer in your family at all?
Yes, ma'am. My cousin, she was diagnosed with breast cancer.
Okay.
5 years before I was. Oh. Yes, ma'am.
Mm-hmm. All righty. So we see that. And then, Ms. Johnson, you had mentioned sometimes it's hereditary genetics, but not always. I think you said 10% or something like that?
Yes.
Okay.
Yep, just 10%. But we like to know the family history because that's important to know.
So let's talk in our last about 6 minutes, resources. We've talked about what it is and so forth. What's available? I'm going to start with you, Ms. Johnson. What's available out there for women?
So what I would recommend...
Or men, for all patients, I should say.
As far as education-wise, be mindful of the resources, what you feed yourself. If you're diagnosed, keep in mind, I like to say you are the driver of this vehicle. No one else can drive it but you. But you want to make sure you give yourself the right information. And so when you go into the internet, right, if you Google breast cancer, oh my gosh, the things that you become, that comes available to you. So I recommend always ORG. You can't fail if you go into an ORG account. .com, try and stick. There's tons of research on breastcancer.org. You have the NIH published information regarding, but make sure you do a reputable site.
Okay.
Within Centera Healthcare System, as I said, we have navigators. And so that's my role. When you're diagnosed, I'm going to follow you from the very beginning to the very end. Okay. And when I talk about the end, that's when you lapped, when you're done your race, when you did whatever your treatment entailed. As I said, every woman is different. Some women get everything. They get the surgery, the chemo, the radiation, some women. So I'm there for that whole lap, right? I say some people, we run a distance. Some people do the 50, some people do the 100, some people do the 400, right? Every woman is different. But also something very unique that we started at Centera is called a survivorship program. So this survivorship clinic is a 2-hour class that we teach on what it means to be a survivor. And that's not just for breast cancer patients, that's for all cancer patients. Right. Because a lot of time, and I can speak for myself, it's like when it was all over, I didn't hear the crowd anymore. Right. And that's scary because you had all these people screaming, you go, you got this, you got this. And then it got quiet. And I didn't know what my new normal was going to look. I didn't know what to expect because having breast cancer at 29 completely derailed, this path that I had going. And so what I say is you have to invest as much time within the treatment process, but also after. So we have this survivorship program, and then there's other organizations that talk about what survivorship. That is so important because it's not one and done, right? As we can clearly see, but you have to do those follow-ups, follow up with the medical doctor, follow up with the surgeon. It's not, that is a part of your treatment for the rest of your life.
Wow.
Right. And so you have to mentally prepare yourself for that next chapter. And so I love the survivorship program that we have, Living Beyond Cancer, because it has a registered dietitian, right, a social worker, right, and we have physical therapists, right, those people that are experts that literally talk about what it means, what next, right, because it's like, oh my God, it's quiet. Right. I haven't seen a doctor in 3 weeks. It's growing. It's coming back. Right. And so it addressed those issues that come up.
That is so important. Candy, what were your resources? We're talking about places, women and men, they need to know these things. Where'd you go? What were your resources?
Well, I did go to one support group by Centera, and that helped a whole lot. And pretty much, like I said, my greatest supporters were my family, my church family, and friends. I just kept myself, I tried to keep myself as active as I could, about what was going on with me. Even during my highs and my lows, they were my greatest supporters.
Absolutely. So would you recommend, you said the support system, the support groups helped you, the one that you went to. Would you recommend that for anyone else?
I do.
Okay,
I do
good.
Recommend it for others. Yes, ma'am, I do.
I wanted to say yes. I'm really excited, Candy, that you did go to support group. A lot of times people go through things internally as breast cancer survivors and they think, oh my God, I'm crazy to think that.
I'm the only one.
Yeah, I did not go to support group, literally, Benita, until until radiation. Radiation, I was like, oh my God, I can't do this. I'm thinking crazy. I need to talk to someone to make sure I'm not crazy. Right. I've been going to support group for 3 years, Benita.
Wow.
And there is literature that says people who attend support groups actually do better long term. And so I really do believe, Scripture says there's power in our testimony, and I do believe that's a part of sharing. And so, and it's supported.
Absolutely. Yeah. We have a couple of minutes left. Resources.
Right. So resources, kind of like what Clarice said, we, Virginia Oncology, we do a lot of referring to the actual support groups at Centera. I do a lot of identifying depending on what the issue is financially. We do have a lot of local organizations, Lee's Friends, Cancer Care of Tidewater, Daniel's Grace. We also have Live On Foundation. We have different foundations that we reach out to locally that actually help our patients a lot financially to make sure that they are able to sustain their actual treatment. So a lot of times it's us forming on partnerships. I do encourage all patients to reach out and see if you can speak to a navigator or even your social worker, because we work hand in hand. Even with her work in Centera and me working Virginia Oncology, it's not weeks that go by, at least a month, that me and Clarice are not touching the same patient. And we make sure to stay in communication to help with that continuum of care, because she can identify the issues immediately because she's met them first in the hospital and different things. And she just say they're coming to Virginia Oncology. So it is very important to have these resources, and your social worker and your navigator. I tell people just to ask for them. We have other components that help financially within our actual organization, and ask and say, can I speak to them? Because it's very important. We'll make sure that you're connected.
Absolutely. Candy, in about 20 seconds, encourage a woman out there who's listening. You only have about 20 seconds. Say something to her that she needs to hear.
Well, if there's a woman out there that's listening right now, and if you're going through breast cancer, I encourage you to keep pushing, keep living. Just know that this is just a process that you're going through. My mom always say that everything happens for a reason. And as you get through the end of this, you'll be able to reach out to another young lady that's getting ready to go through what you've already been through.
Absolutely. Candy, very quickly, how can they find you if they want to get any information from you or contact you? How can they find you?
I can be reached on Facebook, Candy K. Bryant.
Absolutely. Thank you so much, Candy, for being with us.
Thank you, ladies. I appreciate it. Thank you.
Okay, Miss Johnson, contact information. How can they find you?
I'm at Centerally Comprehensive Breast Center on 880 Kempsville Road. My number is 261-5404.
Okay, that is Claire Reese, excuse me.
No worries.
Claire Reese Johnson, nurse navigator. And before on the line we had Candy Bryant, 3-time breast cancer survivor. Miss Poole, how can they find you, please?
You can find me at Virginia Oncology Associates, 5900 Lake Wright Drive. My contact information is 757-459-9218.
Absolutely. This has been a wonderful conversation, ladies.
Yes, it has.
An important conversation. And again, we cannot stress the importance of staying healthy, staying positive, and getting out there. Don't forget that we're here every Friday, 5 to 7 p.m. with the rebroadcast on Sunday, 12 to 2. Don't forget you can find us on Instagram, Facebook, this Hot 91 online, and you can also find me, BK Adams. You can email me, bkadams@nsu.edu. My personal page is B. Benita K. Adams on Facebook. It's been a pleasure talking to you today. Thank you so much. We'll see you next time. This is Hot 91. The views and opinions expressed on this program are not those of Norfolk State University or WNSB FM. Thank you for listening.